In just 39 seconds, 3 pharmaceutical donation records and a 90-day FDA approval timeline raised questions that no prepared statement about health system reform could answer. Senator Patty Murray arrived with financial disclosures. Secretary Robert F. Kennedy, Jr. arrived with a vision for transforming American healthcare. Only one of them had anticipated what the other had brought. May 7th, 2025, 10:20, 2 a.m., Senate Help Committee Chamber, Dirksen Building. The hearing held the particular tension of a session where the ideological stakes were as high as the financial ones. Kennedy had been confirmed as HHS Secretary in February 2025, the most unconventional cabinet appointment of the administration, championed by supporters who believed he would finally hold pharmaceutical companies accountable for what they described as decades of regulatory capture. Senator Patty Murray, ranking member of the Health, Education, Labor and Pensions Committee, had spent 8 weeks reviewing financial disclosure documents that raised a different question about the relationship between Kennedy and the industry he had spent years publicly confronting. Kennedy entered the chamber with the particular energy of a man accustomed to adversarial rooms. Open collar. No prepared statement in front of him. He had navigated Senate hearings before on the other side of the table. He believed he understood how they worked. He did not yet know what was in Murray's folder. Secretary Kennedy, I want to examine the financial relationship between your advocacy organization, Children's Health Defense, and 3 specific pharmaceutical manufacturers. Kennedy's expression shifted in the way experienced Hill observers recognize as controlled displeasure. Between January 2023 and December 2024, Children's Health Defense received contributions from 3 pharmaceutical entities: Heliotherapeutics, $340,000; Brandt Pharmaceutical Group, $275,000; and MedCore Solutions, $410,000. Combined, approximately $1.025 million. Are you familiar with these contributions? Senator, Children's Health Defense has thousands of donors, Kennedy replied, his voice carrying the measured cadence of someone who had navigated hostile questioning before. I cannot personally track every organizational contribution. The foundation operated independently of my current role. I understand that, Secretary, which is why I want to show you what happened after your confirmation. Murray produced a second document, an FDA approval timeline analysis. In the 90 days following your February 2025 confirmation as HHS Secretary, all 3 of those contributing companies received expedited review designations for pending drug applications at the FDA. Heliotherapeutics on March 12th, Brandt Pharmaceutical on March 28th, MedCore Solutions on April 4th. 3 separate companies, 3 expedited designations, 90 days. Committee members on both sides leaned forward. Senator, the FDA expedited review process follows established scientific and regulatory criteria. These designations are made by career scientists based on clinical evidence. I do not direct individual FDA approval decisions. The process is real, Secretary. It also requires documentation. Murray produced the internal FDA review logs. These are the expedited designation approval memos for all 3 applications. Each was authorized through the Office of the Commissioner, your office. Each bypassed the standard scientific advisory committee review that normally precedes this designation. Cutting unnecessary bureaucratic delay in promising drug approvals is a core part of our reform mandate. That is what I was brought in to do. These 3 applications have been awaiting standard review for between 14 and 22 months, Murray replied. What changed in March and April of 2025 that moved all 3 from the same donor pool to the front of the line within 90 days of your confirmation? Secretary Kennedy, one additional document. This is an internal communication from the Office of the HHS Secretary, dated March 3, 2025, 9 days after your confirmation. The room went completely still. The communication, addressed to the FDA Commissioner's Office, lists 3 application file numbers and the following instruction: priority alignment, expedite per Secretary direction. Confirm designation by end of Q1. Those 3 file numbers correspond exactly to the pending applications from Heliotherapeutics, Brandt Pharmaceutical, and MedCore Solutions, the 3 companies that contributed over $1 million to your advocacy organization. 3 companies, 1. Internal directive. The same 90-day window. The FDA Commissioner's Office actioned this directive within 72 hours. Standard Advisory Committee review was not convened for any of the three. Would you like to address the relationship between that directive and the contribution records I've presented? 1. Internal directive. The same 90-day window. The FDA Commissioner's Office actioned this directive within 72 hours. Standard Advisory Committee review was not convened for any of the three. Would you like to address the relationship between that directive and the contribution records I've presented? For the first time in the hearing, Kennedy sat back from the microphone. Senator, I have spent 30 years fighting pharmaceutical industry capture of American regulatory institutions. The suggestion that I would operate as an instrument of the very industry I've dedicated my career to exposing is not just incorrect. It is precisely the narrative the pharmaceutical lobby wants to establish to neutralize genuine reform. Murray didn't raise her voice. Secretary Kennedy, I have donation records, FDA designation memos, a priority alignment directive from your own office, and an approval timeline that places all three donors at the front of the line within 90 days of your confirmation. Which specific element of that documented record is factually incorrect? Senator Bernie Sanders leaned into his microphone. Secretary Kennedy, your supporters believed you would hold pharmaceutical companies accountable. They're watching this hearing. They deserve an answer to that question. The room fell silent. Kennedy sat with his hands folded on the table. Still. By afternoon, the hearing had generated concern across ideological lines unusual even for a polarized Capitol Hill. Kennedy's most prominent supporters in the health freedom movement were among the first to call for transparency, several issuing statements indicating they expected a full public accounting of the approval timeline and contribution records. The crossover was significant. This was not a partisan response. Legal analysts noted that the priority alignment directive raised questions distinct from standard administrative discretion. Bypassing advisory committee review for three companies that had contributed to Kennedy's advocacy organization was, as one former FDA official noted, the kind of documented overlap that congressional oversight exists to examine. HHS confirmed that Secretary Kennedy's office would cooperate with the HELP Committee's document request, and that the FDA approval process for all three designated applications would undergo independent review. It was not a resignation, but it was also the first public acknowledgement that the documented timeline required an explanation beyond principled reform rhetoric. Sometimes the most consequential conflicts don't arrive between political adversaries. They arrive when the documented record raises questions about the distance between public position and private decision. Kennedy had spent decades arguing that the pharmaceutical industry operated through captured institutions. The documents in Murray's folder raised a different question. What happens when the reformer becomes the institution? The 39 seconds changed the hearing. The documents were only getting started. If transparency in government health policy matters to you, subscribe to our channel where financial documentation shapes the story, not the other way around. Hit the bell. The next investigation may concern the health agencies affecting your family. What should congressional oversight prioritize next? Drop a comment below. This dramatized story is inspired by public figures and publicly reported events. All dialogue and reconstructed incidents are fictionalized for educational and commentary purposes. This content explores themes of regulatory oversight and financial accountability and does not constitute factual reporting.